The natural history of coronary artery bypass grafts is primarily defined by the progressive development of graft attrition, which differs significantly between arterial and venous conduits. Understanding these timelines is crucial for long-term clinical management and surveillance. The left internal thoracic artery or internal mammary artery to the left anterior descending artery remains the gold standard due to its superior long-term patency. In early phase, failure is rare, less than 5%, and usually due to technical issues like surgical error, kinking, or steel from a large side branch. In the late phase, beyond 10 years, the internal thoracic artery is resistant to atherosclerosis. It possesses a continuous internal elastic lamina and produces high levels of nitric oxide. 10-year patency is up to 90 to 95%, 20-year patency 85 to 90%. The natural history of SVGs is characterized by a predictable three-stage decline. Unlike arterial grafts, SVGs are prone to graft vascular disease. Phase 1, early thrombosis, 0 to 1 month, incident 5 to 10% failure rate. Mechanism, usually triggered by technical factors, poor distal runoff in the native vessel, or a hypercoagulable state. Phase 2, 1 month to 1 year, intimal hyperplasia. Incidence up to 15% occlusion by the end of first year. Mechanism, the vein arterializes in response to high pressure arterial flow. Smooth muscle cells migrate to the intima causing thickening. While not obstructive on its own, it creates the soil for future atherosclerosis. Phase 3, accelerated atherosclerosis beyond 1 to 5 years. This is the dominant cause of late failure. Unlike native atherosclerosis, SVG plaques are more friable, diffuse, and lipid-rich with a poorly developed fibrous cap. At 5 years, about 75% of grafts remain patent. At 10 years, only 50 to 60% are patent, and half of those remaining will show significant stenosis. Lima to LAD has about 98% 1-year patency, 95% 5-year patency, and 90+% 10-year patency. Radial artery 95%, 88 to 90%, and 80 to 85%. SVG 1-year patency is 85%, 5-year 75%, and 10-year 50 to 60%. Grafts to vessels with high-grade stenosis more than 70% last longer. If the native stenosis is moderate, less than 50%, competitive flow from the native artery can lead to graft string sign and eventual occlusion. The use of dual antiplatelet therapy or aspirin along with high-intensity statins significantly alters the natural history by slowing intimal hyperplasia and stabilizing SVG plaques. Diabetes mellitus accelerates SVG atherosclerosis and is associated with smaller, poor quality distal target vessels. Because of the friable nature of late SVG plaques, percutaneous intervention on old vein grafts carries a higher risk of distal embolization and no reflow compared to native vessel PCI, often requiring the use of embolic protection devices. A major shift in the natural history of SVGs has been the adoption of the no-touch harvesting technique, which leaves a pedicle of surrounding tissue intact, which can produce nitric oxide. A study published in early 2025 demonstrated that 1-year patency rate for no-touch SVGs are now comparable to Lima grafts when used in off-pump CABG. By preserving the vascular adventitia and the vasa vasorum, this technique reduces surgical trauma and preserves nitric oxide synthase activity, effectively delaying the arterialization and intimal hyperplasia typically seen in the first year. Long-term results from the RAPCO trials have solidified the radial artery's position as a preferred secondary conduit over the saphenous vein. There is a growing body of evidence suggesting a survival advantage for the radial artery in patients under 70, though large-scale meta-analysis suggests this benefit is most pronounced when the radial artery is used to target a vessel with more than 70% stenosis. That is true in case of all grafts. The radial artery graft showed an 85% patency rate at 10 years compared to 75% for SVG in that study. Another recent trend is the use of ITA composite graft, that is internal thoracic artery, along with another secondary conduit like SVG or radial artery. Look out for a discussion on ITA composite grafts in an upcoming video.